Imagine you can stop carrying the weight of a painful memory the way you can stop carrying a heavy grocery bag. Not by pretending that it's light, but by changing how your body and mind holds it. What if the therapy can do that for your brain? Not in years, but in just a few weeks and sometime days. That's why people who have tried EMDR often say it felt like the burden of the past is gone off their chest. They feel free of invisible chains and feel like a new person who do not dwell in the past, someone who is progressive and confident and can handle anything in life. All of this sounds amazing, isn't it? If you have been attending talk therapy for a long time or on and off with little to no impact, this video is for you. Today I'm going to talk about science, studies, and stories that explain why EMDR often help people heal faster and more deeply than many conventional talk therapies. If you want to know how EMDR rewires the brain, speeds up recovery, and brings lifelong relief, stay with me. Hello and welcome everyone. My name is Ria and I am a certified mental health professional. I am very passionate about helping you overcome mental and emotional health issues using neuroscience-based information, tips, techniques, and skills that anyone can easily practice in their daily life. My goal is to break all myths, stigma, misunderstandings, and fears around trauma and mental health issues. This channel is all about educating and helping you heal in the simplest ways to be your best. So let us start with a quick check-in about EMDR. What is EMDR? EMDR is a structured 8-phase therapy that helps the brain reprocess painful memories so they lose their emotional charge. When that happens, a person breaks free from living life defensively, controlled by the past. Anyone who is living with unprocessed traumas, either they keep running away or overreact or avoid or shut down or push away the loved ones or keep living in past. Their present and future both get hijacked by something bad which happened in the past. Quite often, they don't even know how a joyful life feel like, how true love feel like, what is trust, and how to live an authentic life. They always feel themselves locked in some kind of invisible cage of assumptions, beliefs, thoughts, fears, and insecurities. During EMDR, a person focuses briefly on a distressing memory through any kind of bilateral stimulation, which can be side-to-side eye movements, tapping, or sounds. The clinician guides the process, helping that painful memory lose emotional control on the person. To understand this, think of a tangled cassette tape in an old player. When the tape gets stuck, there is no music. The player freezes and makes a repetitive gibberish sound. EMDR is like carefully rewinding and rethreading the tape so the song can play smoothly again. The content of the song, the memory stays the same, but it no longer jams the player. Now let us focus on main question of today's video. Why are we doing a comparison of EMDR with regular talk therapy? When people say regular therapy, they usually mean talk therapies like supportive counseling or non-trauma focused approaches. I totally believe that talk therapy have its own value, and it is good to start from there, especially in the beginning, just to be comfortable and understand the therapeutic process and setting. Talk therapy is very helpful in venting, sharing, receiving validation, and build understanding of issues. But if we look at trauma, it's very serious and invisible damage at multiple levels in body and brain. Trauma leaves traces in body and brain. Talking alone sometimes helps, but it can leave the memory and trauma impacts intact in the system. Repetitive talk can open up the wounds, and there is less risk of developing obsessive compulsive patterns when a person tries to heal trauma through talking. This could be talking to one or different counselors or talking to family and friends. Unfortunately, that becomes a never-ending, frustrating, and sticky cycle. You might have heard people saying, "I feel stuck." These are the people who are either not talking about traumas at all or they are over talking about it, most probably with wrong people. Both approaches only do the harm and do not process trauma at all. Sadly, this is true for most of the people. They go for talk therapy to heal from trauma because talk therapy can be an affordable option, but you could have healed faster with long-lasting relief by investing a little bit more in EMDR. Why? Because EMDR is a trauma-focused therapy that directly targets the memory's emotional charge at root level and the way it is stored in your body and brain. To understand the difference, think of two repairs. One is patching a leaking pipe with tape, which is talk therapy. The other is replacing the rotten section and repairing the joint, which is EMDR. EMDR process the underlying memory so the leak stop in first place. Sometimes it may seem too good to be true, and that is reasonable. If someone have spent decades in hiding their inner wounds or just talking about it for a long time, obviously they have developed a belief that inner wounds can never be healed. I am a broken piece, etc. But this is not true, and this is not science-based thinking at all. EMDR has been recommended by major health bodies such as especially for PTSD and trauma-related symptoms. US Department of Veterans Affairs and Department of Defense list EMDR among frontline evidence-based treatment. World Health Organization includes EMDR in its guidance for trauma care as a recommended trauma-focused therapy. These endorsements are published after careful reviews of randomized trials and clinical evidence. When organizations that treat large population like veterans or disaster survivors endorse a therapy like this, it means research shows consistent benefit across many studies and settings. By the way, if you are looking to learn and practice neuroscience based techniques and methods all at one place to practice at home, you are welcome to buy my books, Heal Your Inner Child and the Growth Mindset Blueprint. They are available on Amazon. If you are not a book reader, that is okay too. You can buy audiobook option as well. Audiobook is not very expensive, easy to hear, and you may even get a free subscription from Audible for a few months. So don't forget to check it out. The link is in the description box below. Now, the next point to pay attention is EMDR can work much faster in comparison to talk therapy. EMDR often reduce PTSD symptoms faster than some other treatments out there. Several randomized controlled trials and review papers reported that EMDR can produce symptom reduction in fewer sessions compared with trauma-focused cognitive behavior therapy in many cases. If CBT, cognitive behavioral therapy, is like learning a new long route and detouring to avoid bad traffic on the main road, EMDR is like traffic controller is putting all lights green at the same time so that stuck traffic flows through it again and keep going without stopping on any intersection. Talk therapy and EMDR both reroute you away from daily problems. EMDR can fix the main problem, which was the signal itself. One of my clients, let us call her Maya, came for treatment after a car crash left her with flashbacks and panic attacks. In less than 10 weekly EMDR sessions, the flashbacks decreased to a manageable level. She reported having better sleep and felt less jumpy in traffic. Her reactivity decreased dramatically, and she gained back her self-confidence, which had not shifted after months of supportive talk therapy. Every case is different and individual experiences can vary, but this pattern of gaining substantial improvement in just few weeks rather than months or years is actually quite common in EMDR. Now you might be wondering how EMDR works. Well, it's simple neuroscience. EMDR is guided by the Adaptive Information Processing AIP model. The idea is traumatic memories can be stored in a maladaptive form. Vivid sensory fragments and strong emotions separate from useful contextual information. EMDR help the brain reprocess those memories, integrating sensory, emotional, and cognitive elements so the memory becomes a narrative, not a live alarm. Bilateral stimulations used in EMDR, such as specific eye movements and tapping, appears to engage brain networks that reduce emotional intensity while facilitating memory updating. Studies using neuroimaging and psychophysiology suggest changes in amygdala activity and improved regulation in prefrontal cortex after EMDR. Imagine emotional memory as a file saved with alert tag. EMDR open up the file, remove the alert tag and save it normally so it no longer triggers the alarm. Now, another important point to pay attention is just like you don't keep living with physical illnesses and physical injuries, you should not keep living with psychological wounds, mental health disorders, and dysfunctional patterns. Why? Because brain is a computer. Whatever stays longer becomes firmer. Now it do not go away on its own as well. With time, you just learn to live with that wound until it turns into some alarming health condition such as cancer. Faster symptom relief is not just about saving time. When someone feels terror, shame, or flashback day by day, every day is a health burden. Sleep disruption, missed work hours, relationship issues, and no joy in life. A therapy that reduces symptoms quickly can prevent secondary problems such as depression, someone using substances to cope, relationship breakdowns, and living a life without joy. If untreated trauma is a blazing fire, faster therapy like EMDR is like using a fire extinguisher. It stops the fire from spreading to the rest of the house. You don't want to just sit at one place and talk about damage done by fire on a daily basis. By the way, there is a free workbook in the description box below to help you process emotions and painful memories. Check it out. Most of my clients find it very helpful. Now, you might be wondering, is EMDR helpful for all problems? Well, basically, EMDR was developed to treat trauma, but growing evidences shows that it can help with several situations because there is some kind of trauma underneath every emotional problem. Additionally, EMDR has found to be helpful to treat depression, complicated grief, phobias, some anxiety disorders, particularly when traumatic memories are involved. But several controlled studies and reviews show EMDR reduces co-occurring issues, means more than one issues as well. That is one of the reasons many celebrities utilize EMDR over talk therapy to return to grounding and re-emerge in their careers after traumas. Many artists and athletes have publicly reported EMDR as a turning point for overcoming performance-related anxieties after traumatic incidents. Well, it's also true that everything is not for everyone. There are many micro reasons why EMDR may work for someone or may not. No therapy is perfect. EMDR is a targeted approach that works best when administered by a trained clinician like myself and when client is ready for trauma processing, which is like a useful medicine, can heal quickly but must be prescribed correctly and used in the right dose. Otherwise, results can vary. Many clients describe EMDR as odd but effective. You think briefly about the memory, follow a light or sound or eye movement, you notice sensations and thoughts shifting, and generally people are right away able to feel a huge difference about processed memories before and after session. Over sessions, painful memories become less vivid and emotional charge fades. Clinically, people often report good sleep, less avoidance, and better emotional regulation. Another client of mine, Sam, had intrusive memories after a workplace assault. He also experienced physical, verbal, emotional abuse during childhood. This assault had opened the old wounds as well. About 6 EMDR session or so, Sam reported painful memories felt distant, intrusive thoughts dropped by 70%, and he could return to office without panic. I hope you are finding this video helpful. If yes, it would make sense to like, subscribe, and share. That will be your contribution in spreading awareness about healing from trauma and mental health issues. So, thank you for doing that. Now, you might be wondering why EMDR sometimes help where, not sometime, most of the time help when talk therapy didn't. So, reason number one is rapid processing. EMDR engages memory networks in a way that promotes integration, sometimes showing result in just few sessions. Reason number two of fast recovery is non-verbal processing. For people who struggle to put feelings into words, EMDR works with sensory and somatic traces directly. Means it is not needed to talk in details about painful memories in EMDR. Reason number three is memory reconsolidation. By reactivating the memory and adding new information, which is safety, resource building, and immediate grounding, EMDR does kind of install me. It's like installment of new software. If trauma is a burnt skinned wound, talking is like touching that burnt skin repetitively, which is hurtful and no healing. On the other hand, EMDR is like carefully putting ointment on the burnt skin and healing with a laser beam from a safe distance. It is one and done type of treatment. EMDR requires clinician training beyond general therapy skills. A good EMDR therapist follows ethical protocols, full assessment, stabilization, informed consent, and ongoing clinical supervision. If you are considering EMDR, look for credentials and ask about person's experience with similar type of cases. People who complete EMDR commonly report improvements not only in nightmares, flashbacks, and other trauma symptoms, but also big improvement in relationships, self-esteem, and daily functioning. Because traumatic memories stop hijacking attention and emotion, the space open up for growth, learning, and reconnections. Now let us look at how EMDR fits into a larger healing plan. EMDR is powerful but often works best within a broader plan. I create a holistic treatment plan for each of my clients, which also includes skill building for whatever problem they are facing. I teach somatic exercises, emotion regulation skills, effective habit building, even for sleep, learning to build healthy boundaries with yourself and others. If you're already on medication and you want to stop them, going off medication could be a gradual process which can be part of your treatment plan. If you want to do that, that will be a coordinated process involving your physician as well. I hope you make an understanding by now that EMDR is one of the most evidence-based, often faster and deeply transformative therapy available today. The science supports its use, institutional guidelines recommend it, and thousands of clinical stories confirm that people regain life after using EMDR. EMDR is excellent for reprocessing painful memories and experiences, and it can be combined with other therapeutic tools such as mindfulness to maintain long term wellness. If you or someone you care about carries the weight of a memory that still hurts, I would advise you to get professional help. If you want to improve yourself without using medications, you can reach out to me. I am professionally trained and experienced in EMDR and EMDR intensives, which are internationally popular in helping people not just living with traumas but any emotional issue, mental block, and unhealthy habits. There is another video on the screen, it might be showing right now, which you may find helpful. So you are welcome to watch that. Thank you for joining me today on this little journey. I will meet you next time in my next video. Bye for now.